In the Space and Clinical Operations Division, we spend a lot of time thinking through all the various medical conditions that could occur both on an ISS mission and an exploration mission. We actually have a research arm called Exploration Medical Capabilities that's dedicated to thinking to the future and what kind of medical conditions should we prepare for or be able to screen out. We have some tools that we use. One of them is called the Integrated Medical Model. It helps us encapsulate all the medical conditions we think are possible, have some probability, and then we look at the consequences and start talking about what is the smart thing to protect for from a medical kit perspective, what is a smart thing to be able to screen out, and what are smart things to be able to prevent. A lot of it is based on terrestrial medical knowledge, so we use that to the degree to which we can, and then we also have to apply the effect of spaceflight to the degree to which we understand it. So how much does being exposed to microgravity and spaceflight change the probability or the consequences of any given medical condition? And that's why some of our lists look differently than what some of the military lists might look like. We have a lot in common, but we have our unique application of the material. All of these tools and our thought process through these medical conditions also have to include the fact that there might be underlying changes occurring that we may or may not be able to image or know to even go look for that could change the likelihood or consequences of any medical condition occurring. So the visual impairment intracranial pressure issue was one of those where the crew members were not really ever expressing concern about the problem. There were slight vision changes that were considered temporary but were recovered post-flight. It was thought to be due just to the fluid shift during microgravity exposure. Images were not being taken of the back of the eye to understand if there was an anatomical change until very recently. We had the opportunity at the end of the shuttle program to do some pre-post images on eyes for shuttle flyers, and we did notice some anatomical change even under short duration flight, which clued us into that there can be adaptive responses, anatomical and physiological change that don't result in symptoms. So you have an asymptomatic problem, but for how long? So it was ISS that gave us the perspective that eventually these changes will result in symptoms. In some cases, people had visual acuity changes. In other cases, it remained just an anatomical change, but never impacted their functional vision. Trying to understand the risk and the application of this knowledge to exploration has been challenging because, again, similar to the bone loss, when does this change plateau? Which individuals will be affected and why, and to what degree are they affected, that it could have a mission impact or it could have an impact to their personal health that would go into their long-term health. As I mentioned before, we're still concerned about the condition that they leave the Corps with. I think currently our need to understand this better and gain more knowledge about the mechanism and the degree to which the changes will impair a person's functional vision or their ability to operate during a mission helps program managers and the agency understand risk. And the more knowledge we can put on the table, the more they will be transparently accepting or mitigating the risk by putting resources into mitigating this problem. At this point, we don't know enough to tell them what mitigations are actually practical or would have an effect that would change the outcome. So we're still in a knowledge gathering phase of the project, and we'll probably be doing that until ISS is closed. We're constantly pursuing the unknown, but given resource constraints and practical application, you have to kind of confine what you're going to go looking for and why. I think imaging modalities in medicine have opened the door for taking pictures of things that have never before been seen and documenting and cataloging. Now it's a matter of us understanding the database of normal. And if I take an image, what does this mean in terms of outcomes months and years later, and also under stress as well as not under stress, meaning once I put someone in space, just because I knew what the image looked like before, does that mean anything about how outcomes will change because of the image I saw? One of the concerns we have is chasing down false positives. So if you take an image and you're not exactly sure what the results are going to tell you, you have to be prepared for information you may not understand. And at this point, we consider that part of the documenting of and archiving of someone's baseline physiology and anatomy. And it's only until after they come back and we redocument post-mission and then throughout the rest of their career that we would understand what it would mean for them as an individual. We have the lifetime surveillance of astronaut health dedicated to that type of activity.
In the arena of physiological abnormalities, I have the opportunity to manage approximately 20 operational flight surgeons, and we constantly emphasize the importance of being vigilant for physiological changes that take place. A lot of emphasis has been put on recently for the evaluation of the papilledema, ocular changes, and intracranial pressure changes that might exist. We really don't know what else is out there, and so as we look at our exploration class missions, there are several things that come across our spectrum. For example, the risk of fracture on a planetary body. We really don't know yet where the plateau changes for any additional osteoporosis. So for example, on the planetary surface where we're going to be doing frequent EVAs, the potential risk for fractures such as during a fall and an outstretched arm and a wrist fracture is something that has entered the equation that we're thinking about. The risk of renal stones. We know that there may be more calcium being mobilized. So potentially on these long-duration missions, is that risk of renal stones going to be much higher? Also, the immunological system. We know that our immunological system is dialed down during long-duration spaceflight, but where is that threshold for exceptionally long periods of flight, and how that's going to implement the overall ability for us to handle any viral or bacteriological issues as well as any skin conditions that may take place. Another issue that we've had to deal with in the recent past is the dust level on ISS, making sure that we maintain a high level of cleanliness, of housekeeping. We had a dust buildup that arose that caused some discomfort for some crew members, some upper respiratory type of issues, and also required us to use some medications to help mitigate that. So I think having the vigilance and the sensitivity to think about other habitability issues to maintain crew health is going to be very important. So for future long-duration flights, it's imperative that the crew members and the flight surgeons communicate very well so that we may pick up any subtle changes in their overall medical condition or physiological state. And also it's vital that managers understand that these issues are going to creep up and we don't know what's on the horizon, and we'll have an opportunity to handle them appropriately if we keep an open mindset and work together.